Good morning, good afternoon, everyone. Welcome to the next Lunch and Learn, or today's Lunch and Learn. We're very excited today that Tessa Conroy is able to present What Does the 1980 Flu Reveal About the Economic Impacts of a Pandemic. As always, if you've been in this particular Lunch and Learn before, when you come into the Lunch and Learn, your microphone is on mute, but you are able to unmute yourself and ask questions. If you don't feel comfortable doing that and you have a question that you would like to ask, I'll keep an eye on the chat and voice your question for you. So with that, I'd like to thank Tessa for being here today, and I'll turn the floor over to you.
Thanks, Kristen. Good to see everybody. This piece, I'm kind of presenting a version of an article that I wrote for WisContext. So if you do find this interesting, I just wanted to tell you all before I forget, there's the full text at WisContext available for you to read or to share however you'd like to use it. So I started looking back at the 1918 flu, and I'll just give the sort of background here is that when this all started in mid-March, and I was trying to understand how this would change things. And also there was a humbling moment for me too, because this is my first recession in my adult life. In 2007, I was living in another country, I was in college, and it didn't, impact me the way it does now. And so I just wanted a way to understand the current recession, a way to benchmark. And this time, even though it was, 10 years ago now, it's different this time, and wanting to understand that better. So I started looking at what was out there, and this article is what came of that. So I'm glad to get to share it with all of you today. So just to give some basics about what I learned about the 1918 flu in Wisconsin specifically, that I arrived in Wisconsin in the fall of 1918, and it was an interesting context. It was just a few weeks before the end of World War I. And they actually think that was part of the spread of the flu, that as all of these soldiers were returning home, and the disease spread on their paps and in their returning home. So I thought that was interesting, but just a unique time period as well. And it hit Wisconsin in a pretty large scale when we compare it to other events. 103,000 residents became ill and 8,000 died. So that's more than were lost to World War I, the Korean War, and Vietnam War combined. So a pretty large scale event. What was most interesting, though, that I learned was that we were the only state in the union to respond with a statewide comprehensive approach. So nowhere else in the country was there a coordinated effort at the state level to respond to the flu. And it turns out that this really made for unique circumstances and a pretty successful outcome. So the foundation for a public health response, the way this came to be in Wisconsin, being the only state to have a statewide approach, this started decades earlier, actually. Wisconsin was an early adopter of several public health initiatives. So the first one that I learned about was in 1876, that Wisconsin was one of the first states, I think it was just the 10th state, to implement a state board of health. So even several decades earlier, we were already thinking about public health initiatives. And the board was given the power to act in the interest of public health. So that means they could do a lot of the things the Department of Health can do now in terms of ordering a quarantine or leading public health education initiatives, changing the rules to keep people safe, these sorts of things. And as part of having the State Board of Health, the law required that all localities have a local Board of Health. So it created a network around the state, so sort of a centralized State Board of Health, and then they had direct channels out to the communities to make a policy change or to communicate a new initiative. So this really pretty well-established network was in place by 1918. We had almost 1,700 local boards of health. So I learned in some ways, how similar the interruptions to daily life were then as they are now. Large gatherings could spread infection, so residents were directed to avoid crowds. So, no sporting events, no large celebrations. All public institutions were ordered closed. All localities were asked to close their schools, movie theaters, bars, restaurants, and churches. So that also felt very familiar. and nearly all cooperated within a day. So that was also fairly unique, that not only did we implement a statewide initiative, but that people actually followed it was fairly unique. And so these two things together really sort of credited with pretty good outcomes with regard to the flu. Of course, there was a lot of loss, and I don't mean to make small of that, but when we look at other states, Wisconsin really did pretty well. So low death rates in Wisconsin, pretty much every paper that I looked at showed pretty low death rates depending on kind of the period they measured. So for example, in Wisconsin, we had 2.91 deaths per 1,000 compared to 4.39 nationally. A different way of looking at it is the excess mortality rate, so deaths over and above what you would expect in a typical flu season. 360 per 100,000 was one of the lowest in the country. Milwaukee had one of the lowest death rates for cities of its size, and I think that you can see that in the figure there, that Milwaukee is sort of the very lowest line there. And then another thing that this reading pointed out is that we really can't attribute, or there hasn't been a strong link in terms of these good outcomes that would link these good outcomes to climate or geography or economic conditions. So we can't really say it's the case that, well, Wisconsin was a really wealthy state at the time and that, let them do things that explain these low death rates, for example, or the climate and geography are different and that explains it. Really, it seems to be the case that it arrived late here. So, similar to now, that it started on the coast and then worked its way, inland. And so it arrived late to Wisconsin. So that's one thing. Low population density is another factor that they attribute to those good outcomes. And then this sort of this intervention, this non-pharmaceutical interventions that we had at the state level, taken together, the literature I was reading really kind of pointed to these three things as explaining the outcomes for the 1918 flu. So yes, the impact of non-pharmaceutical intervention. So basically that means social distancing. I'm not, don't have a medical degree, of course. So when I was reading these papers, I was trying to make sense of what is a non-pharmaceutical intervention. And I think they basically mean social distancing and hand washing and some of these things that we're all being instructed to do now. But the relative success in health outcomes is not attributable, like I said, to all of these economic things, but these non-pharmaceutical interventions made a big difference. And what was maybe most interesting to me as an economist in reading about this study of these types of interventions is that not only did it seem to explain the relatively good outcomes, but the states that intervened early and aggressively, their economies bounced back faster or performed at least as good as, if not better than, all of the other economies. So in addition to having this sort of public health impact, it seemed to be linked to also an equally good recovery, if not better. And in terms of thinking about why that is, the paper in my reading was sort of light on mechanisms, but I would speculate, that this has something to do with, well, if you don't have as many people that are, are sick or recovering or in sort of dire financial situations from having been sick, then you can get back to normal quicker. Perhaps it's a consumer confidence thing that in these places where the outcomes were relatively good and the situation was relatively under control, people had more confidence about kind of getting back to restaurants or getting back out and spending their money again and these sorts of things. So I thought that was interesting as well. So the consequences in 1918. That's a little bit about the death rates and in terms of the mortality outcomes, but I want to talk about some of the other outcomes as well. So even though Wisconsin, like I said, seemed to do relatively well in this context, certainly there were impacts felt throughout the state. So hospitals still faced a shortage of beds and healthcare workers. Communities responded with temporary emergency facilities and volunteer support. So that also felt familiar. Here I have a picture of a temporary hospital in New York. So some of those sort of parallel measures seem to be taken and that localities implemented anti-influenza educational initiatives. So sort of re-educating the public on how to prevent this. So, you know, the examples that I saw were, you know, making sure people knew to cover their cough so that their cough, knowing that their cough could spread the sickness, or washing hands, or, you know, spreading out when they rode or were in tight spaces, excuse me. So some of these initiatives were what we saw. The rural and urban context was also interesting to me, and the differences. And again, maybe some parallels to today, that rural seems to benefit from low population density when it comes to, you know, a public health consideration, a disease. And so rural areas did sort of benefit in that they ultimately were better off. So rural areas had, you know, less severe mortality rates and these sorts of things. But what's also true of rural areas is that they didn't have the financial resources to run the large-scale public health education campaigns. That people were sort of dangerously uninformed in some rural areas. Their hospitals were not resourced in the same way as the hospitals in Milwaukee, for example, in terms of the, you know, the technologies and those sorts of things available. So that was interesting to me. But in urban areas, it's just high capacity. It's a lot of people in closer quarters. So the number of patients still overwhelmed the healthcare system. So sort of different challenges across the rural and urban spectrum. To be more specific about, you know, how much better did rural do? One of the things I found was that in Wisconsin, the ratio of the mortality rate for cities compared to the state average was 1.17. So that means that in the urban areas, the mortality rate was about 17% higher than the state altogether. So it's really the rural areas that seem to be driving the low average for the state, suggesting the urban areas had higher mortality rates. So an interesting outcome there. And then the flu changed life in Wisconsin. So it was most severe for prime age adults, especially men. And that's different than today. It seems to be the case today that our most vulnerable populations are, you know, 65 and older, 70, 80, that these are the populations that are most severely hit with the coronavirus. But back then, it was much more likely that these people were still in the labor force. So we can imagine how that would impact households if it's young working age men. So at the time, this is really, you know, a dominant breadwinner group. If those are the people who are getting sick, then the family is losing a breadwinner. And even if it's just for 2 weeks, the time it takes to recover, that could still be really devastating. So that was one interesting finding. And then the campaigns, there were, you know, several local elections, and then if I'm remembering right, I think it was a presidential election. I think I have to look that up again. But the elections that fall all switched to mail outreach. So it wasn't the case that they were having rallies or bringing people together. That this was, you know, a different style of election season that year. Businesses, of course, suffered, missed months of revenue, and that's familiar as well. Those in health and health-adjacent industries did very well. So there's sort of a little bit of a pandemic economy or a health economy. There are going to be segments that do relatively well that are connected to products and services in high need areas, and those do quite well, whereas others, and of course, all of those connected with accommodation, health, food, are really hit very hard. So things really are reallocated in this context. Farmers fell ill, animals went untended in fields and unharvested. And so that presented food supply challenges in 1918, and I think we're seeing sort of parallel food supply challenges now. You know, if any of you are reading about outbreaks at meat supply plants, of course, it looks differently, but this question of concern over food supply and how workers in those industries, what happens when they get sick, there seem to be some sort of interesting parallels in some ways. In terms of the economic impacts, First, I would just say there's not a lot of data to go on. We didn't keep track of county level income and all of these types of things that some of us rely on now in our daily work. There have been a few studies though. So one study found that GDP declined in the range of 6% at the country level. So this was an international study, and that on average, the countries that were impacted experienced about a 6% decrease in GDP. Higher wages, this is sort of interesting, but it's very sort of classical economic thought in that if a lot of people get sick and we have a labor supply restriction, then those people who do go to work are going to be going to work with the same amount of equipment and producing more per worker to keep up with demand. So we should expect to see wages increase. That productivity per worker is going to go up, their wages are going to increase. And in fact, we did see some of that there were actually higher wages. And what comes with that is income growth. So they did find state level income growth, that in those states that were hit harder, where they were experiencing this labor supply, and then a little bit of a tight labor market can sometimes drive up wages and income. And so we see that kind of on both levels here. That said, these sort of what you might call positive impacts on the economy, I would just encourage us to think about those, of course, in a balanced way, meaning that these small gains were coming alongside very large declines in productivity. So, as the sort of pandemic moves through the country, we had huge overall losses in productivity, and you can see this in manufacturing, for example. So weighing the sort of overall costs with, any potentially what might be small gains. In general, though, these were pretty short-lived. The impacts just didn't last very long. They were associated with the immediate circumstances that came with the pandemic. And then as the pandemic subsided, so did these effects. And one study that found longer-term impacts was those looking at the cohort of people that were born shortly after the pandemic. For them, they found some long-term effects in terms of, this cohort or generation of people born immediately after the flu. They had some sort of longer-term, lifelong economic struggle. So their human capital or education attainment wasn't as high, their lifelong earnings wasn't as high, and that sort of thing. So perhaps some lasting health, or there's some sort of intergenerational mechanism in terms of, well, maybe their parents' finances were hit, and so that sort of creates this ripple effect. So some potentially long-term consequences in that particular study. So as I said, I went into this kind of hoping to create a framework for myself, or a way to benchmark what's currently happening in the economy due to the pandemic, and create a way to understand it or have some guideline for what might happen. And what I learned is that it's probably really more different than it is the same. And that's probably not surprising. It's 100 years ago. There's maybe not a lot that is directly comparable, but some differences I think that are still interesting. So first, as I pointed out earlier, the 1918 flu was most severe for the working age population. So that's different than now. So, all of the benefits associated with being at work somewhere, whether that's healthcare, insurance, all of those things associated with employment are going to be different than they are now. It's a population that's out of the labor force. So these types of things certainly make a difference in terms of lost productivity, how this affects households. The 1918 flu spread along transportation routes, and today we travel over a much more extensive network. So we have a lot more ways to travel at a higher frequency, at a higher volume. So that's a lot different today. And from an economic perspective, production is also geographically dispersed, much more so. So for example, Wisconsin manufacturers maybe felt some of the effects early on when China was kind of battling the virus more intensely. So because those plants were shut down. And so some of those plants that provide inputs to factories in Wisconsin, they're struggling at this point. Now we're seeing this again. I come back to the kind of meatpacking example. As different places struggle with different outbreaks, that affects the supply chain in different places. So it's hard to contain the effects of the illness spreading just through the nature of our supply chains. Is going to have ripple effects and also affect production in other areas. And then that in 1918, these effects were also potentially conflated with a wartime economy. So it's harder to know for sure, what was the result of, we had a lot of soldiers coming home. There's sort of this shift in the labor market. We had a lot of wartime financing, all of these to sort of sift through and untangle and figure out, what were the effects specifically associated with the flu versus, what's attributable to, a wartime effort, for example. So it makes things a little bit more complicated and a little bit more difficult to try to identify some lessons learned that, might be useful now. Credit to Steve for this figure. He sent it to me in an email and did not know I was going to steal it for this presentation. So these are the initial unemployment applications, so new unemployment applications in Wisconsin. And what you see in orange is the new weekly applications for 2019. And then in blue is the same week in 2020 and in cumulative form. So how are these adding up over time? So now what's important, I think, to keep in mind is that we have all of these different federal programs now. So in terms of the many differences that are really important, the federal programs is one that stuck out to me. So, here we are looking at unemployment insurance for 2020, for 2019. That didn't even exist in 1918. Wisconsin was the first state to enact unemployment insurance, and that wasn't until 1932. So to give an example of sort of the weight or magnitude of this program, from mid-March to mid-April, we had 400,000 new applications for unemployment insurance in Wisconsin. So this program that has come to be sort of an essential part of the recovery for probably, certainly a lot of people, a lot of households that didn't exist back then, and that can bring some stability to those households. Similarly, Social Security, so formerly known as Old Age Survivor and Disability Insurance Program, also passed in the 1930s. So that program where, something like a survivor's benefit might have been relevant for families in the 1918, but the program didn't exist for them. So in 1918, had a family lost a breadwinner and this program would have existed, there might have been some benefit in place to help them, get out of losing an earner in their household or help them maintain income security during that time. And these programs just weren't there. And then economic and fiscal policy in 1918 were also very different. So the Federal Reserve, which has been, I would say, really very active in policy over the last 8 weeks, was just 5 years old in 1918. It was a relatively new institution. It didn't have the same presence that it did now. It was mostly there to finance the war effort at that time, or that had been their main activity. They didn't have such a hand in stabilizing the economy and those sorts of things. And even if they had, I think what's interesting about that period is that before 1930s, even if the Federal Reserve had the sort of presence and wherewithal to enact policy, the way we thought about economics, before the Great Depression, basically, would have said, let the markets correct themselves. There would have been little appetite for a federal spending bill. So with John Maynard Keynes in the 1930s, and we're responding to the Great Depression, when I think about fiscal stimulus, that was really I think of that as the first major federal spending bill that we saw, where economists started to think about how the government can initiate spending in a way that offsets contractions in other parts of the economy and have this stabilizing effect. That was relatively new to the 1930s. So in 1918, even if we had the Federal Reserve, even if we had considered it, I just don't think the way we thought about economics, I don't think the political will was there for some of the programs that we're seeing today. So fiscal stimulus, as I said, John Maynard Keynes kind of credited with this idea of these big spending bills, and wasn't really used in a large scale way until we saw the Great Depression in the 1930s and we had the New Deal and some of these things. So what does this look like today? So monetary policy. So the Federal Reserve is a well-established institution. They're much more present in policy discussions, much more active in stabilizing the economy during a downturn. And their main role is to lower interest rates on debt incurred on large purchases. So those are houses, cars, these sorts of things. The Federal Reserve has lowered interest rates to near zero and indicated, keeping it there for the foreseeable future. So giving people some sense that they're not going to, yank the interest rate around, that we have these low interest rates going forward. We're seeing quantitative easing. They don't call it that, but everything I've read says it's basically, even though they're not calling that, it's basically quantitative easing, which is something we saw for the first time during the last recession. And then they have a pretty large role in stabilizing markets. And again, I'm not, I wouldn't ever consider myself a monetary policy expert, but it seems to be the case that, one of the concerns here is about liquidity, that, for those businesses that don't have the cash reserves to get through this program, that this is really about kind of injecting cash to make sure that we have the necessary liquidity in the economy. So these are the main roles of the Federal Reserve, and that we've already seen several of them, their tools deployed in the last 8 weeks. When it comes to fiscal policy today, so fiscal policy is at the discretion of Congress and the White House, and we mainly focus on two tools for fiscal policy: changing tax rates and changing government spending. We've seen several initiatives here. I'm talking about the first three. So $8 billion in emergency funding to support the coronavirus response. So that happened first. Then we had the Family First Coronavirus Act. It didn't have a dollar amount attached to it, but it's expected to cost close to $200 billion, if I'm remembering correctly. Yeah. And then the CARES Act, which we've probably spent the most time talking about. So centered on $2.3 trillion fiscal stimulus package. So that's the largest ever in US history in terms of, a government spending initiative stepping in to offset spending contractions in other parts of the economy and try to introduce some stability. So these tools, I have this in the article, I think this will be our 19th recession since 1918. So we've had a fair amount of practice, I like to think, in terms of understanding the business cycle, understanding what sort of policies work well, and hopefully we have some familiarity with the tools that it can be used to improve people's lives as they are impacted by the downturn. One thing that is unique, well, there are lots of things unique, but one thing to keep in mind is that these are unfamiliar circumstances. So we're using familiar tools, but we have unfamiliar circumstances. And what I mean by that is most of the time recessions, or we think of recessions as being caused by a particular type of shock. So a demand shock, a supply shock, a financial shock. And this has elements of all three. And so it makes for a particularly complicated policy environment. Are we in a better position than 1918? I think we all hope so. I think policymakers especially hope so. But I was asked the other day, what do we think about these policies and programs? Are we doing it right? And I certainly think there's consensus, at least in the economics profession, is that there was and there is a need to do something quickly and right away, that this is impacting families right now. And so something like these direct cash payments, they're seen, again, to be consensus around policy measures like that. But I think, we now, as we economists have decades of homework in front of us in terms of understanding, did we use the right policy at the right time in the right amount? I think we'll keep asking ourselves that over and over again going forward. And there's a big opportunity to learn from what we've done so far. So those are just my thoughts in terms of looking back and trying to understand the 1918 flu. And I don't know if there are any comments or questions, but I'm happy to chat.
I would love to, Tessa. I thought this was great. I have a feeling, I suspect everybody else did too. But I saw some comments from Patrick in there about the generation that grew up after the flu, which are in the chat box. And then one of the things that really struck me was actually the social aspect. If we go to 1918, and you were saying that in Wisconsin, is evidently the order came, am I correct that an order of sorts came down from the governor's office or something like that, that you need to implement these practices and procedures to follow them correctly? Was there pushback?
So I want to make sure I wasn't on mute. My understanding was that there were a few places that didn't understand the order, that I'm trying to remember right. Like one community kind of interpreted it as a suggestion. And it was really more of a directive. And so there was a lag in terms of them implementing some of these policy measures that came with some health costs, that, you know, they did have some more health struggles. But my understanding is that, you know, for the most part, once the state health official said we need to take the statewide approach and ask the localities to do it, that we really had very widespread and very quick cooperation.
I would think that at least a part of that was the result that we had declared war against the Germany and its allies. And when Wilson declared war, he went all in. I mean, you know, he made Lincoln's writ of habeas corpus look like pissant generosity. It was like, you will, you will, you will. You know, so if you're in that, you will, less likely to say, I don't think so.
Mm-hmm. Yeah, I think a very different social climate, of course, and sense of cooperation.
There's a question on the chat about, how did this, do we know how past events like this impacted parts of the community that are not frequently covered and those with particular challenges, people without documentation, members of Native nations at the time being. And she also, this is Victoria, she also said, thank you for talking about this.
Yeah, so great question. I mean, I could hardly find things that were specific to Wisconsin, a little bit on the city of Milwaukee, for example, but drilling down into demographic detail. I mean, like I said, we have a little bit about age. We know that the working age demographic was impacted more severely, but no, you know, my comments that it seemed to be the case that rural fared a little bit better through all of this. Even that was hard to pin down. I found one study by the Federal Reserve who had identified the states in their region and kind of cobbled together a bit of a story for rural to make the case that it wasn't as severe in rural. So it was just, you know, with the data that was available, it was just hard to know. But, you know, I suspect that there are equity issues going back to 1918, of course, as well.
I'm sure there were, but the whole immigration pattern and rules and guidelines were completely different.
Very different.
So, you know, you might have been dissed for being Irish or
right.
or German or Mexican, but it didn't have that same kind of, you know, being illegal or undocumented. I'm sure if you said something like that to somebody from 1918, they'd be like, what?
Tessa, this is Brandon. Have you looked at any contemporary countries? I just read something, I think it was yesterday, that was talking about the countries that went swift with lockdowns, and it actually was one of your slides that talked about the states that did it seem to recover more quickly or more rapidly.
Mm-hmm.
And I know it's really early, but have you looked at any contemporary societies? And the two examples they were giving is Germany versus England. In England, it was very slow, and they sort of let it rip through the population, and then Boris Johnson had a change of mind. And whereas Merkel had a very different approach. I'm just curious if you have any insight there.
I don't. Those, so I wrote this at the end of March, beginning of April, and those stories were just starting to bubble up, and it's already time for an update, I think. And as you mentioned, that we're learning more and more. So yes, I would like to do this sort of update looking at the variation in responses over the last, few months and see if any sort of story emerges. But yeah, I mean, the Germany and England comparison is certainly interesting.
Did you notice any difference, because the economy back in 1918 there wasn't the global economy we have now? Did that have any influence on things, because you bought everything and you produced everything pretty much in short range around your community, versus now you have Walmarts and Dollar Generals and things come from all over the world to small towns?
Right. So my sense is that the world was still sort of tangled or impacted through global connections because of the war. So we had soldiers that were in shared spaces and in Europe and coming home. So we had some of those challenges with the movement associated with the war ending. That said, you're right, that production is different now. We have geographically spread out production and supply chains. And so I do think that that's a difference. And that's, as far as I can tell. So, for example, when one region of the world or one region of the country even is struggling with an outbreak, and we see how that affects production in that particular place, that ripples through the supply chain. And so everybody that's downstream from them also gets now a bottleneck. And I think you see examples of that with when China was struggling with the virus and how that affect inputs into US goods production. It's kind of hard. My sense is that it's hard to pin that down. It's hard to know kind of when and how much and who. But certainly those ripples were felt based on anecdotes I'm hearing. And then also, I think you're seeing it even locally about, again, I keep coming back to the meat supply chain just because I've been reading so much about it, but, as one particular plant, and we're very consolidated now too. So, we have a handful of meat packing plants go down, and that's 15% of meat processing in the country. And so, it's not necessarily the case that means a widespread shortage, but it does create, noticeable hiccups in the supply chain that go through the country and show up in grocery stores in a more spread out way.
Actually, if you look at the absolute amount of international trade, we're not that much higher now than we were back then. I think people are kind of surprised at how much international trade was going on 100 years ago. But Tessa touched on the difference now. It's the supply chains, is that we've specialized. So much of the manufacturing in the US is they get their parts from China. And it's those supply chains that become much more complex. So when you have a disruption in the supply chains, that's different today. And it's one of the discussions that's coming out of some of the Department of Defense rumblings, is that our military industrial supply industry too vulnerable to international trade disruptions? For example, microchips. Most of those are made in China. So, our multi-million-dollar fighter jets are dependent upon parts that are made in China. Are we exposed because of that supply chain? But the absolute amount of international trade isn't that much higher today than it was 100 years ago.
Interesting.
With that being said, Steve, has anybody thought about doing some research or future systems thinking in regards to what this might look like as we're working toward coming out of this into that new normal?
Yeah, there's been a lot of discussion at the federal level that our manufacturing is too exposed to China. The problem, though, is that the U.S. doesn't have kind of a true national manufacturing policy. So even if we as a country decided that we wanted to tackle that from a policy perspective, we don't have that tradition in the US. We really have kind of let the markets determine what's best for the supply chain. So while there's an acknowledgement that we should be more strategic about this, we don't have a tradition of having national policies that actually tackle that. So yes, but is there the political will to actually do something, because it's so against our kind of the way that we think about how a capitalist system works?
Tessa, did you get any sense of the timeline of recovery from looking at the 1918 data?
Yeah, so that was interesting too. A couple things come to mind. One is the waves of the virus that it came through 3 times. So spring of 1918, fall of 1918, and then again kind of spring of 1919. So that was interesting that, you know, we kind of continued to struggle with this. But I also, from the documents that I read, my sense is that it arrived very, very swiftly. It hit very, very severely and then was gone almost as quickly. And so, to me, it relates to this sort of flattening of the curve conversation we've had, you know, that without any flattening of the curve, you know, our communities are hit pretty suddenly. So it's a very tight, but very tall looking line. And that's sort of the story that I got from the documents that I was reading, that it came to these communities. It didn't last very long, but man, did everybody get sick all at once. And then it's gone, and the people that are able can go back to work relatively quickly. But that it's a very, what's the right word, kind of crisis intensive short period of time.
Tessa, this may not be a fair question because it's kind of a medical question, but in your reading, was there any kind of hint as to why it just all of a sudden disappeared?
Oh, that's interesting. I did not read about that.
Actually, the suspicion is that, you know, it burned out the immediate people and kind of took a rest break to mutate, because that the very first wave, the very first clumpish stuff, wasn't that virulent. That second wave was horrendous, you know, where they took out virtually, you know, so much of Philadelphia, and you saw all the military camps, just blowing up, was when it had mutated to this incredibly effective organism that could easily transmit and had such violent impact. And then the next couple of waves were bad, but it had mutated again to be not quite as virulent. But that sort of, the second coming, as it were, was just god awful, and the sort of the things that came along with it. I mean, the doctors weren't even sure it was flu. They weren't even sure it was influenza. And I mean, some people were thinking it was the plague because they were developing essentially what was bubonic pneumonia. Right. So, but it had a lot to do with mutation, and then just the travel with all the soldiers back and forth.
So back then we got kind of lucky. The flu bug kind of just did itself in.
Eventually, but I'm not sure that I would have called 25 to 50 million people lucky. And I've even seen some estimates that push it more towards 100 million.
Yeah.
Maybe lucky is the wrong word.
Yeah, really big ranges in terms of knowing the impacts. One thing that I did read about that was interesting, you know, I've been reading these sort of science articles in terms of, you know, the science community trying to understand the virus, how it's transmitted, what are the features of it, and these sorts of things, and how once scientists in China had the, genetic makeup figured out, it gets uploaded to the cloud, and then it's being downloaded in Europe, and they're working on vaccines. And I don't know, all the intricacies of how that science is shared, but when I was reading about the 1918, in comparison, it just took us a long time to understand it. And, if we think we don't know what's going on now, my sense is that they really, were scared and didn't know what was going on in 1918. And one of the, many, aspects of confusion was whether this was transferred from human to animals. We didn't know. And one of the causes for concern with that was that we had a swine flu in Iowa at that time, I believe it was Iowa and Illinois. And so there was this concern of, is this a hog flu that's being transmitted to humans, or have the hogs gotten the human flu? And it just took us a very long time to sort that out.
It's important to remember that we weren't that far off from the actual discovery of the germ theory. And they did not actually identify it as a virus until well after the pandemic. I think it might have been the 30s or 40s. Mm-hmm. It was also, that whole time was the beginning of really strong public health and the relationship between public health and the medical research, because the scientists, the doctors at the time were working really hard. They just didn't have the same level of knowledge and the same kind of equipment. So it was just taking much longer.
Yeah. And just on an anecdotal note, I read a couple instances of, the way doctors and nurses were really celebrated at that time. And that also, felt familiar, that the way they lifted up their healthcare workers and were so deeply appreciative of, the hours they put in and the circumstances that, they put themselves in the front line then. And it was just an interesting parallel.
I have another question. I've been told I get 3 talking tickets. This is my second one, so I'm cashing it in. So again, this is maybe an unfair question, but I'm just curious if so I had heard and I've read again that there's any great problem that we've run into in the United States, and the pandemic is an example of it. There's sort of the silver lining is there's massive structural changes politically and socially and economically that tend to follow. And I see a lot of potential silver lining that's happening right now that is sort of uncovering the inequities that were there and maybe pushing the political envelope a little bit more in terms of what's happening. And I'm just curious if you've had any thought, or you have any, I don't want to say predictions, but any thoughts about what might be on the horizon, from healthcare to technology to, the way that we localized or, have our food systems and so forth. Do you have any evidence, or did you find anything that you could learn from the pandemic that would point us in a direction of understanding what's on the horizon?
Yeah, I don't know. I don't want to be over speculative, and I think where you stand on this depends on where you sit. So, for example, with healthcare, is it the case that we've underinvested in healthcare for quite some time, and that's left us, particularly vulnerable? So, is this, the beginning of reinvestment in healthcare infrastructure? These sorts of things? Does it highlight our healthcare system and the ways it works and the ways it doesn't? So I was reading about some of those effects. Certainly in education, is this going to demonstrate that we can deliver education remotely? And I had an interesting conversation with somebody who kind of made the argument that in higher education, for example, we compete on sort of this educational resort idea. And if you strip away the resort component, if you don't get to sit lakefront, if you don't get to go to the nice gym, if you don't get to, X, Y, or Z, live in the nice place, and all that's left is delivering skills and training, who has the comparative advantage in education now? And it maybe looks different than it did 6 months ago. So some of these sorts of questions, certainly I think it pushes a lot of issues that we were already talking about. It makes them more acute. And I think there are new topics as well. I mean, the things I've been thinking about with, Gail, Matt, Steve, Kristen, and others is broadband, for example. We knew that was a problem before going into this. Now we really know. And I think it's pushing that conversation maybe a little bit forward and changing, maybe has potential to change our investment patterns. I think childcare is really an acute problem for families right now. Those that have children at home and both parents are trying to work. I think that we're seeing the way childcare impacts the labor force maybe more acutely than we were. So those are some of the things on my mind, but I think there are definitely others, definitely new ones that we haven't talked about. I'd welcome other comments.
I think as we look at, I think Pandora's box is open. And as we look at healthcare, I think one of the things that's probably going to change that you've seen a lot in the federal regulations is how we deliver that healthcare and telehealth. I think, we've opened Pandora's box and we're not going to go back. We're seeing that the fear was economically, if we open that box, it would cost more money. And now we're seeing maybe that's not quite the case. And so they're looking at that at the federal level. I think some of the rules that have been relaxed to be able to deliver that, I don't think once we're through with the pandemic, we're going to go back. Because it also helps us look at how do we deal with that shortage of healthcare providers, especially in rural communities. And some of our healthcare providers were delivering services maybe at a loss because they weren't being reimbursed because of the way rules were set up, and that's changing.
If I could follow up on Gail on the healthcare, this is something that a lot of rural hospitals are really worried about because a lot of them were on thin financial ice before the pandemic, and a lot of them have basically had to shut down. And there's a real concern that a lot of them are going to not survive. Now it comes into, do we let the markets respond, or do we have to have more of a public policy response? And I think that's where we're going to have a really heated debate nationally, is the role between just letting the markets decide what the response should be and how much of a public policy response should there be. But I'm not sure about Wisconsin rural hospitals, but there are some states, Oklahoma, for example, that they are scared to death that they're going to end up with only 2 major hospitals in the state of Oklahoma. It's that could be some. I think one of the things that we as a group need to think about is what are kind of the topic areas, like say broadband, say childcare, say rural health, can we kind of make a difference in? Because some of these broader issues like international supply chains, that's beyond stuff that we can really influence. So I'd love to have kind of a broader discussion of what are the kind of the topics or the issues that we can kind of sink our teeth into and take advantage of this, again, poor choice of words, take advantage of this opportunity.
Steve, I'll echo that, and also in reaction to what Brandon had said earlier, that I was thinking, what if we put together not just a response to the immediate pandemic, but what would our silver lining look like? What would be our larger agenda items that we would want to push forward that we think we could have an impact on? That would be, I think, a really interesting discussion right now and really fruitful in the long term.
Yeah. I'm sort of maybe at this particular moment most interested in how this will change the distribution of income. Like these equity effects are really interesting to me. It seems to be perhaps another moment that is kind of pushing a more bimodal distribution. So is this just going to widen the gap, perhaps? So some of these questions, and I think moments like these also kind of re-expose or bring to the surface again a lot of racial disparities that we have, and we need to talk about those as well. And then just some industries are going to be different.
Tessa, one of the,
This is
my,
yeah.
go ahead.
This is Brian. I just want to go back to that manufacturing or the systems chain scenario, and this may be simple, looking at it very simply in my part, but give you a quick story. Simpson Electric, which is owned and operated by the Lacta Flammable Tribe, it makes analog test meters and digital meters. During this process, they jumped on the bandwagon and started manufacturing shields, those medical shields. And what they did is they didn't make a ton of them, but they made enough to disseminate them to, I believe there was 4 tribes and a couple of local medical facilities. So they would have them. They didn't make a ton of money on it, but they did it. And I'm just thinking out loud that some in a rural area where we do have some manufacturing, that some of those pieces of things that are missing I'm just thinking, is there an opportunity out here to rethink those things occurring in areas that, you know, maybe could handle that if we were able to help them do those things, or at least get them down that path a little bit.
Brian, I think you gave a great example of what makes the future of manufacturing in the U.S. It's not going to be making, you know, a gazillion inexpensive widgets. It's that ability to turn on a dime. That's the future of manufacturing in the state in Wisconsin. I think in the U.S. is that ability to shift production and move from one thing into another thing. And I mean, that's something that we have to work with our rural manufacturers, that they have to look at these market opportunities to be able to shift on a dime. And I think that's a good point.
So friends, we have time for maybe one more question. We're 4 minutes till 1 o'clock, and Carl's weekly COVID-19 update is at 1 o'clock today. So if anyone's got a quick question, or a comment, something they'd like to share.
So this is maybe a little out of context now, but I was thinking that I went back much further than you did, and I went to the bubonic plague that Pat brought up, and the Black Death of 1347 to 1350. That I'm reading. I've always been interested in that, just because I'm weird like that. But just really detailing it out and reading the best book I've read, actually by an American guy, called The Great Mortality. But there's way too much to talk about, but the gist of that from the social aspect is that, first of all, 1 out of 3 people in Europe died. So if the population of Europe was about 100 million, then about 33 million died. And frankly, in the most gruesome ways imaginable. But the other thing is, after the death, after the mortality, labor, which had always been treated so horribly, like serfs and slaves, was demanding a price 4 times as much as they were getting paid before. And remember, 670 years ago, the only people that could write were the better off, the wealthy, and so you see a slew of verbal abuse against these damned laborers for wanting to raise the price of their wages and everything. And yet it's a move towards equality to what had been essentially almost slavery. But that tremendous impetus, and it took Europe population-wise 1 to 200, in some cases 300 years to recover that population, because these plagues kept coming back in smaller doses with succeeding generations, depending on which country. But things like the printing press were invented, 100 years after the plague, because you just didn't have the labor to work on books anymore. Things like so. These are some of the things that showed up afterwards, and I think I better stand down. So thanks.
That was a great note to end on. Tessa, do you have anything else you'd like to add before we close?
No, just thanks so much for your time. And again, for those of you who want a bit more, that article is at WisContext if you want to take a look.
Awesome. Thank you all for coming today. This will be posted shortly.